If you talk to Republicans about Obamacare, they will tell you there is nothing worse than the specter of hardworking folks getting their health insurance plans canceled.
It became clear to him that the president was being misleading when he said that if you like the plan you have, you can keep it.
People are finding out that they can no longer keep the health insurance they like.
I have a letter from a woman named Emily. She's losing her policy. She says,
and he received this cancellation letter because millions of Americans are going to receive letters like this over the next couple weeks.
The people who currently have insurance may lose their insurance.
Every cancellation from insurance companies or from businesses was put at the feet of the evil Obamacare machine. And Republicans, well, you know how they roll. They see a problem, they want to fix it. One of the problems Republicans wanted to fix was the employer mandate, which requires employers with 50 or more workers to offer health insurance to full-time employees. So Republican Congressman Todd Young of Indiana, apparently eager to blunt the force of that almighty mandate, put forward a bill that would define full-time as 40 hours a week instead of the current standard of 30. And guess what? The Congressional Budget Office, you know, the one the GOP sometimes loves and sometimes hates, the CBO said this Republican tweak to the employer mandate would kick 1 million people off their employer-backed health coverage. The report projected that more than 500,000 of them would end up getting coverage through Medicaid, the Children's Health Care Program, or the Obamacare exchanges. The rest, another 500,000, would simply be uninsured. Oh, but it gets better. How much would this reduce the deficit? Because we all know nothing animates the Republican Party more than reducing the deficit. What's that, you say? Oh, it would increase the deficit by $74 billion over 10 years. Impossible! Of course, this bill is not going to become law, but it is very instructive as a reminder that any actual commitment to legislating our unbelievably complex Byzantine health insurance regime will create disruptions in that system. And the Republican strategy to kill Obamacare has always been to point to the disruptions it might create, that it has created, and say the end of the world is nigh. But of course, if they ever actually got around to implementing their own plan, well, guess what? That would have its own disruptions. And this Friday, House Majority Leader Eric Cantor will meet with key Republican leaders to work on putting together what will be billed as the House Republican alternative to Obamacare. Well, here's my prediction. He could come out of that meeting with 24 alternatives, but the Republican Party will actually get behind exactly none of them, not in any real way. Because that would mean grappling with the reality of reforming health care and not just throwing stones from the sidelines. And that is why I have been saying, and I will say again, that the Republican alternative to Obamacare is a unicorn. It is beautiful, it is mythical, and it does not exist. Joining me now, Neera Tanden, president of the Center for American Progress. What do you think, Neera? Are we going to see a real Republican alternative to Obamacare?
Look, you know, actually the Republican alternatives that have circulated in the past, the one that Senator McCain campaigned on, the ones created by think tanks in the last year or so, they have coverage losses of 11 million, 15 million, 20 million people. So I think it's going to be challenging for them to run their ads around the country through these nefarious groups attacking Obamacare for coverage loss when any alternatives are going to have much greater losses of coverage. And let me just be clear about something. We're talking about loss of coverage from employer-based coverage, which is, you know, as you know, it's the coverage that big businesses, medium-sized businesses offer today. It's the best coverage. It's much better than the coverage in the individual market that they were clamoring about, which is actually the worst kind of coverage.
Well, that's why, and that is why, I mean, hopefully that coverage in the individual market gets better the longer the Affordable Care Act exists, which is sort of the point. But the reason that I think it actually makes, what I think is funny is that the Republicans seem torn between two poles. On the one hand, right, they don't actually want to propose an alternative because that exposes them to all the political risks you indicate. Then the CBO scores it, and it says your alternative will do all these terrible things, and they have to defend it. At the other time, they look ridiculous if all they do is talk about how horrible the Affordable Care Act is, and they don't propose anything to replace it with. And so they are caught between those two, and I think they want to kind of occupy the space in between those two as long as they can to get them towards Election Day.
Look, we're at like 5 years of the Republican alternative is just around the corner. So, during the discussion of the Affordable Care Act, there was always going to be an alternative, never really materialized. 2010 elections, there was going to be an alternative, never really materialized. And I think it's for this precise reason. They don't want to have the responsibility of governing to actually fix the problem, right?
Yeah.
There are things you could actually fix. They don't want to fix the problem. They want to have a campaign issue. And look, I think over the long term, the challenges on the Affordable Care Act have we've turned the corner on the website. People are getting coverage. I hope there will be one day where we don't actually have to talk about an alternative because they'll accept this as a law of the land because it's actually helping people.
Yeah.
People who never had health insurance are getting it today.
I go back and forth on when that date's going to be. It'll happen eventually, but it'll be interesting to see when it actually happens. Neera Tanden, president of the Center for American Progress. As always, thank you.